Discover the rejuvenating power of masturbation in later life, a key to health, happiness, and vitality. Have you ever wondered what happens to your body and mind when you continue to masturbate regularly even at an advanced age? This question may be taboo for many, but it is crucial for your health and well-being. In our society, the topic of sexuality in older age is often silenced. Outdated beliefs label older people as asexual, but the truth is quite the opposite. Sexuality remains an essential part of life, regardless of age. Why should you keep reading? Uncover the myths surrounding sexuality in later life and learn the scientific facts. Discover how masturbation can positively impact your physical and mental health, from improved circulation and pain relief to stress reduction and mood enhancement. Gain a new quality of life by learning how to take control of your sexual health as you age. Masturbation is a natural and healthy part of life that plays a role at every stage of life. In later years, it can become even more important, helping you reconnect with your body and rediscover your sexual identity. The remarkable benefits of masturbation in older age are diverse. Physically, you benefit from improved blood circulation, which supports genital health and prevents tissue atrophy. Endorphins act as natural pain relievers, easing discomfort, while the release of oxytocin and dopamine promotes relaxation and restful sleep. Studies even suggest that masturbation can reduce the risk of prostate cancer in men. Mentally, masturbation has a calming effect due to the release of oxytocin and dopamine, which help relieve stress. Dopamine also promotes positive feelings and increases joy in life. Masturbation also helps you embrace your body and get to know yourself better, leading to self-love and acceptance. Masturbation is a crucial key to living a fulfilling and healthy life in old age. It empowers you to live your sexuality with autonomy, supports your health, and enhances your quality of life. It is important, however, to find a healthy balance and pay attention to your own needs and boundaries. Excessive masturbation can have negative effects. Be mindful of your body and emotions, and seek professional help if you feel you are losing control. Like any activity, masturbation can have negative effects if it becomes excessive or compulsive. Maintaining a healthy balance is crucial to sustain its positive effects and avoid undesirable consequences. Excessive masturbation may lead to physical discomfort and temporary sensitivity issues. Repeated stimulation of the genitals can overload nerve receptors, resulting in temporary numbness, a loss of sensitivity, or mild pain. These symptoms are usually not permanent and tend to disappear when the body is given enough time to recover. In extreme cases, constant friction can cause skin irritation or minor injuries, particularly if proper lubrication is not used. Men may experience irritation or temporary hypersensitivity of the glands, while women might face similar irritation in the vaginal area. Therefore, regular care and breaks between sessions are essential to prevent these problems. Another potential downside is known as orgasm fatigue. Frequent orgasms can leave the body feeling drained over time, manifesting as low energy, difficulty concentrating, and general fatigue. This is because sexual stimulation and orgasm release various hormones that affect circulation and the nervous system. With a healthy rhythm, the body has sufficient time to recover and replenish its energy reserves. On a psychological level, excessive masturbation can cause issues as well. In some cases, it may indicate underlying emotional or psychological challenges such as loneliness, depression, or anxiety. People who feel isolated or lack social support might turn to masturbation as a form of emotional comfort. While this can provide temporary relief, there is a risk that this habit could become an emotional dependency over time. Excessive masturbation may also disrupt the brain's reward system. During orgasm, large amounts of dopamine are released, creating intense feelings of satisfaction and pleasure. However, constant artificial stimulation can lead to dopamine desensitization, meaning that the same stimulus becomes less satisfying over time. This may cause individuals to seek more intense stimulation to achieve the same level of pleasure, a phenomenon known as dopamine dulling. Furthermore, this behavior can negatively impact self-esteem, leading to feelings of guilt or shame, particularly if individuals feel they are losing control over their actions. This can create a vicious cycle of guilt, stress, and compulsive behavior. Excessive masturbation may also affect social interactions and relationships. People who spend a significant amount of time on sexual self-stimulation might begin to neglect other important aspects of their lives, including social connections, hobbies, and even professional responsibilities. For those in relationships, it can become problematic if it affects sexual intimacy with their partner. If a person regularly fulfills their needs through self-stimulation, it may reduce their interest in shared sexual activity, potentially leading to misunderstandings and tension in the relationship. Open communication and maintaining a balance between self-pleasure and partnered intimacy are essential. Social isolation and withdrawal from relationships may also increase if masturbation becomes a primary source of emotional support. Older adults who may already experience loneliness or a reduced social circle might further distance themselves from their surroundings through excessive sexual behavior. It is important to actively nurture social contacts and activities to maintain a healthy balance between sexuality and social relationships. In some cases, excessive masturbation may be part of a broader psychological condition, such as compulsive sexual behavior disorder. This condition is characterized by repeated and uncontrollable urges for sexual stimulation despite negative consequences. People with this disorder often struggle to regulate their behavior and may feel overwhelmed by guilt and shame. Professional help, such as counseling or cognitive behavioral therapy, can assist in identifying the underlying causes of compulsive behavior and developing strategies for behavior modification. Support groups or sexual health counseling centers also offer valuable resources for those dealing with this issue. To avoid the potential downsides of excessive masturbation, it's important to develop a conscious and mindful approach to your sexuality. Self-reflection is the first step. Examine your motivation and the frequency of your masturbation. If you notice that you frequently use it as a response to stress, loneliness, or negative emotions, it may be helpful to develop alternative coping strategies. Set limits and take breaks. Schedule intentional pauses to give your body and mind time to recover and regenerate. Promote an active lifestyle. Maintain social connections and engage in activities that bring you joy. An active lifestyle can help you find a healthy balance between sexuality and other aspects of your life. Do not hesitate to seek professional support if you feel you are losing control of your behavior or if you struggle with feelings of guilt and shame. Masturbation is a natural and healthy practice that offers numerous physical and emotional benefits. However, it is crucial to maintain balance and respect your needs and boundaries. Excessive masturbation can lead to both physical and psychological challenges, particularly if it serves as a coping mechanism for unresolved emotional issues. Through mindful self-care and nurturing social relationships, many of these risks can be minimized. Masturbation is not only a source of pleasure but also a means to promote physical and emotional health. It allows older adults to experience their sexuality in a new, self-empowered way, helping them to age with joy and vitality. Sexuality does not end with age. It evolves and remains a vital part of overall well-being. Masturbation can help older adults rediscover their sexuality and enjoy a fulfilled, healthy life in later years. It is a valuable aspect of self-care and contributes to improving quality of life as we age. It is essential to speak openly about sexuality in later life and emphasize the positive aspects of masturbation. By adopting a destigmatized and informed perspective, older individuals can be encouraged to take charge of their sexual health and lead a fulfilling life. Talk to your doctor or therapist if you have any questions or concerns. They can help you achieve a healthy and satisfying sex life as you age. An open and informed dialogue about sexuality in later life is essential to break down outdated beliefs and taboos. Many older adults feel insecure or ashamed to discuss their sexual needs and desires. This can lead them to forego the positive aspects of sexuality and masturbation in old age. It is important to emphasize that sexuality is a natural and healthy part of life, regardless of age. Older adults have the right to sexual autonomy and should be encouraged to actively manage their sexual health. The role of partners and family members should not be underestimated. Partners can support and encourage each other to maintain a fulfilling sex life. Family members can also play a crucial role by creating an open and supportive environment where sexuality in old age can be discussed. It is important for older adults to know that they are not alone in their questions and needs, and that professional help and support are available. Research on sexuality in later life is still ongoing, but current findings are promising. There are increasing studies that demonstrate the positive effects of sexuality and masturbation on the physical and mental health of older adults. This research should continue to be promoted to develop a comprehensive understanding of the sexual needs and desires of older adults and to provide evidence-based recommendations for sexual health in later life. In addition to the benefits already mentioned, sexuality and masturbation in later life can also help strengthen older adults' self-confidence and enjoyment of life. A fulfilling sex life can promote feelings of connection and intimacy, helping older adults feel comfortable in their bodies. This is particularly important at a time when many older people face physical changes and the loss of partners or friends. It is crucial that older adults have access to comprehensive information and counseling on sexual health. Doctors, therapists, and other professionals can help them understand their sexual needs and desires and maintain a fulfilling sex life. It is also essential that older people are informed about the risks and side effects of medications and treatments that may affect their sexual function. In summary, sexuality and masturbation in later life can be vital components of quality of life. Through open and informed dialogue, support from partners and family members, and access to comprehensive information and counseling services, older adults can take control of their sexual health and enjoy a fulfilled and healthy life in old age. It is time to break the taboos surrounding sexuality in later life and encourage older adults to explore and embrace their sexual needs and desires.